Hey, my name is Dr. Chill. You must be here for a checkup. Is that correct? Great. It's very good to see you. Please just take a seat. Thank you. So, as you're probably aware, this hospital is currently severely short-staffed. So, I've been very kindly flown in all the way from the UK to be here to give you a checkup today. It's quite a long flight and I'm a bit jet lagged, but I'll be fine. Us British doctors are known for being rather calm under pressure, so you have nothing to worry about. So, how have you been feeling recently? Have you had any health concerns or problems which I may need to know about? Okay. Okay. That's fine. And when was the last time you come for a checkup like this one? Okay. No, that's fine. It's good that you've come today. These checkups are just a great way of both of us being able to gauge the general state and well-being of yourself. So, thank you for coming today. So, you probably know what you're here for. You're here for a checkup. So, this checkup is going to be split into a few different parts. So, first off, I'm going to be giving you more of a physical kind of checkup. And then I will be using my lights and getting close up, just having a look around your eyes, around your face, just to make sure that everything's okay. And then we've got some tests kind of in between the two of those. So this will be very relaxing for you. Please don't hesitate to tell me if you feel uncomfortable or stressed at any point. I'm here to help you, okay? Great. So, the nurse, I believe, has already taken all the notes from you, the most important notes, is that correct? Okay, got the basics down. Is it okay if I just ask you a few different lifestyle kind of questions just to help me gauge a bit more about yourself? Great, thank you. I'm just going to put these gloves on first. I don't like writing without gloves on. When I'm a doctor, I don't know. It just feels natural. It's a bit of a weird thing, but I'll put these gloves on now. Must be a British thing, I don't know. Okay, perfect. Yeah, the weather certainly is nice today. Makes a difference, big difference from being in the UK where it's always cold. It's nice to be in the Florida sun. Cool. Okay. So, I just have a few basic questions for you. Nothing to be concerned or worried about. Just try and answer them as truthfully as possible. Okay? So, can I have your date of birth, please? Okay. And was that 2000? Yeah. Quite a young, very young, envious. And do you smoke? No. Okay. And do you drink alcohol on a regular basis or just a kind of weekend kind of thing? Okay, mainly just on weekends with your friends. Okay, that's fine. Me too. There's nothing wrong with having a few drinks every now and then. I need him as a doctor for sure. Weekends. Okay, perfect. And can I ask, on average, how many hours of sleep do you get per night? Yeah, well, we like to try and aim for 8 hours, but we live busy lives. Sometimes it's hard to get those full 8 hours. So yeah, about 7. That's absolutely fine. You should be able to function very well on 7 hours of sleep. And finally, how would you best describe your current state of health? Yeah, it's quite an open-ended question. Have you had any visits to the doctors in present times? Any serious problems? No, and you feel generally quite healthy at the moment. You're breathing easily. Yes. Yeah, it's certainly a good sign. I like to think we usually are best judges of our own health. Okay, that's great. But it's good to have a checkup just in case. Yes, that's correct. Okay. Now I might take some notes throughout this examination just to for my own reference, okay? So, now, is it okay if I just get a body temperature reading from you? Yeah. All I need you to do is just open your mouth as wide as you can. That's it. Perfect. Okay, now I'm just going to put this thermometer just underneath your tongue, just to get an accurate reading, okay? Perfect. Okay, open up wide. Okay. Okay, perfect. Perfect. Okay. Just leave it in there for a few more seconds to get a accurate reading. Okay. Perfect. Thank you. Okay. That's a very good temperature, very level. We don't want to be too hot or too cold. I know it's currently flu season and there's a lot of stuff going around, so yeah, it's good that you haven't caught anything yet. Fingers crossed you don't catch anything more. Okay, so now I'm just going to check your vital signs, so just your heart, your lungs, and also your kidneys as well. Just looking for a nice stable beat, no inconsistencies or tremors or anything like that. Do you feel like you have a healthy heart? Can you walk without running out of breath too easily? Yes. Do you do a lot of running? Okay, so you're quite an active lifestyle. That's good. Very healthy. Okay, so please just take a few deep breaths in and out just to get that oxygen regulated and that blood pumping. That's it. Just one more big deep breath. Come on. You always feel good after a nice deep breath, don't you? Okay. Just to warm this up for you. There we go. As all doctors should be thinking ahead, caring for their patients. Okay, so first I'm just going to check your heartbeat, okay? I'm just going to get in close, just like so. Okay, just perfect. Okay. Okay, perfect. And I'm just going to check your lungs and your kidneys, okay? So just stay still. That's it. Just relax. Okay. Perfect. Okay, everything seems to be pumping very good. Nice, steady. Okay. Perfect. Okay. Just relax. That's it. Great. Well, you'll be happy to know that you have a very stable heartbeat and everything else seems to be in great working order. So that's a very good start. Just going to write that down. Okay, it's perfect. And that's it. Just, okay. Vital signs are all in good condition. And everything seems to be perfect. Perfect. Well. Okay, so now I'm just going to be physically checking your upper body, your chest, and your arms, and just under your throat as well. I just need you, before we begin actually, just to take your blood pressure reading, if that's okay. Yeah, okay. I promise it won't be too tight around your arms, just tight enough to get a good reading from you, okay? So if you just want to rest your arm out like this, facing towards me. Perfect. And I'm just now going to put it on for you, use the pump. Yeah, don't worry, I won't make it too tight. I know it can be quite a strange feeling having something wrapping around your arm like that, but don't be concerned, it won't hurt. Okay, just move your arm out like so. Just going to put it on for you now. Great, just wrap it on. And that's it. Now, just going to very gently pump it up. Again, this won't hurt, don't be concerned. That's it. Couple more pumps. And okay. Great, perfect. A very good reading again. Your blood pressure seems to be pretty much average, so that's very good. I'm just gonna let go now. And take it off. Okay. Again, thank you. Now, like I said earlier, I'm just going to be checking around your chest, around your throat, around your arms, just to see if everything is how it should be. There's no problems, underlying problems that need to be addressed. So just relax. Just gonna very gently just move my hands around your chest, just looking for any problems, any issues. I'm just going to turn around. Perfect. Just feeling for any problems. Any problems. Okay. Okay. And okay. Okay, now please just lift your head up a bit, please. That's it. Just going to be looking around your lymph nodes just to see if everything is okay. Perfect, perfect. Okay. Okay, just apply a bit of pressure. And okay. Perfect. Great. No obvious signs of any issues, which is again a very good sign. Now, I just want you to rest your arm out facing towards me. Just your left arm first, please. Just out. The elbow pointing that way. That's it. Now I'm just going to be testing your reflexes up and down both arms. I'm going to be using this reflex tool, so this won't hurt. I won't apply too much pressure. I'm just testing to see if your nerves are responding as they should be, okay? Cool. So just wrap your arm out like this, and that's it. Great. Now just your other arm, please. That's it. Okay. Perfect. And just up. And just again, just testing. And one more time. Great. Your nerves are responding very well to that pressure. Your nerves are very important. They connect your whole body, so it's good to test those out every now and then. So now, if you could just please turn around, face the wall over there. That's it. So I'm just going to be checking down your spinal column, around the back of your kidneys, just seeing if I can feel again for any problems, anything we should need to look at in a bit of a deeper detail, okay? So just turn around, face the wall, just feeling, just around. Okay. Keep your head again focused at the wall. Just moving my fingers down your spine. Very gently, just feeling for any obtrusions, any problems. Checking your posture. It's very good to do this, just to see everything is fine. Perfect. Okay. Just feeling around. That's it. Okay. Okay. Okay, that seems to be all good. Please turn around and face me again, if you want to, of course. Okay, so again, everything seems to be in tip-top condition, which is very good. Just write down a few notes. Yes, do you feel, I'm guessing you work, yeah? Do you sit down at a desk most of the day? Okay, do you feel like your posture while sat at work is good? Straight back against your chair. That's good. Yeah, it's good that we look after our posture at a young age, because all the damage bad posture can do at a young age can significantly get worse as you get older. So try, when you're sitting down, walking, just to keep a straight back. It just helps a lot. Okay. Give gentleman recommendation. Okay. Perfect. So now I'm gonna have a look around your face, just to get a visual check, just to see if I can see any problems, anything to be concerned about at all. But it does seem to be. Do you suffer from dry skin at all? I do as well. It can be significantly worse in the winter months. Dry skin is not really a serious problem, but if you use a moisturiser, something just to add a bit of moisture to your skin, it can help a lot and just help keep away any of that dryness, which can be quite annoying and quite uncomfortable in the winter. Okay, so I'm just going to be using this light just to have a visual look around. I'm just going to get up close. Just need you just to keep your eyes open, keep them relaxed. If you need to blink, blink. It's fine. Just going to have a look around. Okay. And just having a look just around. Okay. Perfect. That's it. Okay. Just having a feel around. Okay. Perfect. Just examining you, just having a look. Okay. Perfect. Just having a look. Up and down. Okay. Perfect. Can I just ask you just to open your mouth as wide as possible? I'm just going to have a look down at your throat to see if I can see any inflammation or anything which may need treatment. Okay, just keep your mouth wide open. That's it. Just having a look. Having a look. Okay. Perfect. Just having a look. Okay. Okay. And now I'm just going to have a look up your nostrils. Don't worry if you need to sneeze, just let me know in advance, okay? Just having a look. just going to do some basic eye tests with you just to see how your eyes respond to the light. Have you ever visited an optician before, or an eye doctor? Okay. And I'm guessing they never recommended wearing glasses or having contact lenses in. Okay, that's good. Yeah, I mean, it is good that you don't need glasses, but it's also important to check your eyes on a regular basis just to see if we can find any problems. Your eyes are a very good indicator of potential underlying health problems, so even if you feel your eyesight is good, please do get your eyes checked on a regular basis. Okay, so now I just need you to follow the light. I'm just going to keep these eye tests very simple. I'm just going to have a look at your eyes and way they respond to the movement and the light, okay? Okay, so just keep your eyes focused on this light, okay? And back to the middle. And to your right. And back to the center. Okay, now just need you to follow the light up and down. Okay, just around now. Just around. Okay. And just a bit closer, just keep your eyes focused on the light. That's it. And around. And around. Perfect. Just gonna have a bit look at your right eye. I thought I saw some problem. Just keep your right eye just open. Perfect. No, nothing to be worried about. I thought I saw something, but it was nothing. Don't worry, it's just a shadow of a light. Okay. Now, I just need you to have a look at both hands. I need you to tell me each time I put fingers up just how many fingers I'm actually holding up. So I just need you to tell me. Okay, so again, keep your eyes just focused on the hands and let me know how many fingers I'm holding up, okay? Doing very well so far. Perfect. Great. Great. Perfect. Okay, just gonna have just a visual look around again just to make sure. Perfect. Yes, your eyes do seem to be in exceptional condition, which is good. I can't see any problems with your eyesight or any underlying issues. It all seems to be absolutely perfect.